They deal with pollution, they protect biodiversity in our cities or towns. And so I would urge you to hear the recommendations of the local government officials. We've got one from Lyon and another from Cameroon.
Dans nos territoires urbains, nous subissons les effets de différents phénomènes qui affectent notre santé. Pollution de l'air, vagues de chaleur extrême, inondations, insécurité alimentaire, perte de biodiversité ou encore émergence de nouvelles maladies. Ces phénomènes sont liés les uns aux autres et ils s'intensifient. Mais ils ne touchent pas tout le monde de la même manière. Dans toutes nos villes, les inégalités sociales et territoriales façonnent l'exposition au risque, la vulnérabilité et l'accès aux solutions.
Face à ces défis, les villes agissent déjà. Partout dans le monde, les élus locaux améliorent la qualité de l'air, transforment les systèmes alimentaires, protègent la biodiversité et renforcent la résilience face au changement climatique. Car dans les villes, une évidence s'impose. La santé humaine, la santé animale et la santé des écosystèmes sont indissociables.
C'est précisément le sens de l'approche One Health. Les villes sont idéalement placées pour la traduire en actions concrètes en reliant les politiques de santé, d'environnement, d'urbanisme, d'alimentation et de climat. Mais aujourd'hui, nous devons franchir une nouvelle étape.
Si les crises sont globales, les solutions commencent souvent dans les villes. C'est pourquoi nous lançons aujourd'hui un appel clair, la création de la One Health City Alliance, coalition internationale des villes engagée pour mettre en œuvre concrètement l'approche One Health.
Il est temps que les villes du monde unissent leurs forces pour faire de One Health une réalité sur le terrain. Cette coalition permettra de partager les connaissances, de développer des solutions communes et d'accélérer les politiques urbaines qui améliorent simultanément la santé des populations, des animaux et des écosystèmes. Car les défis auxquels nous faisons face dépassent les frontières de nos villes et de nos pays, mais les solutions peuvent aussi dépasser ces frontières.
En unissant les villes du monde autour de One Health, nous pouvons transformer nos réponses locales en un mouvement global pour les sociétés plus saines et plus résilientes. Ensemble, faisons des villes les moteurs d'une nouvelle alliance entre santé, environnement et climat.
This is a very powerful message. And again, cities, communities are at the heart of what we're aiming to do today. Maintenant, nous allons passer au deuxième panel, un panel qui est intitulé
Now we'll go on to
Surveiller,
the second
détecter,
panel discussion,
anticiper,
which is monitor, detect, anticipate, regaining the upper hand against emerging health risks. And we're going to see how important monitoring is to face up with health risks, because as we've heard on a number of occasions in the course of the summit, it costs 100 times less to invest in prevention than it does to react to a health crisis. Now, we can say that we're in the world after the recent pandemic. So in this world, which is post-pandemic, we can see two questions. Are we really prepared to deal with the next crisis? It would be interesting to see. I think we can probably do better. And the next question is, what can we do to have better coordination and preparation so that we can have an effective and efficient response to the crisis?
She's the director of the Global Health Program at Chatham House, and she's also a renowned specialist of global health. She will be moderating the second panel. Madam Ross, over to you.
Thank you. So I must apologize in advance. My intro is not going to be as jazzy as Richard's was, so sorry for that. But as the title of our panel suggests, we're going to hear today some of the political commitments being made to strengthen the way we tackle outbreaks using the One Health approach. There is clearly a lot to do at the political level, but the truth is that One Health lessons we've learned over the years were not applied in the COVID pandemic. There wasn't the prevention, in part because we had no integrated disease surveillance across humans, animals, and the environment, and upstream drivers were still neglected. We had no One Health preparedness strategy, and the transdisciplinary capacity was underdeveloped. there was no One Health response to speak of. Silo systems were not bridged. We didn't manage the spillback from animals. So One Health was more a rhetorical banner than an operational reality in the response to the pandemic. The pandemic did certainly elevate One Health on the political agenda. Clearly, we're here today. And I'm looking forward to hearing today from our panelists what they're planning to do to make One Health work on the ground. So I'd like now to invite our panelists to join me on stage. First, Dr. Emmanuelle Soubeyran, Director General of the World Health Organization, the World Organization for Animal Health. Dr. Philippe Duneton, Executive Director of Unitaid. Please join us. Take a seat. Mr. Alain Mérieux, the President of the Institut Mérieux. Mr. Peter Sands, Executive Director of the Global Fund to Fight AIDS, Tuberculosis, and Malaria. Welcome, Peter. Just next to Alain. And last but not least, Mr. Stavros Nicolaou, Group Senior Executive for Strategic Trade at Aspen. So welcome all of you. Now I'd like to invite to the podium our first speaker. So this is not all we have more. Please welcome His Excellency Samdech Moha Borvor Thipadei Manet, Prime Minister of the Kingdom of Cambodia.
Excellency, distinguished delegates, ladies and gentlemen. It is my honor to join the One Health Summit 2026 on the World Health Day today. I highly appreciate the government of France for hosting this summit at such a pivotal moment for humanity and our planet. All of us can still remember the outbreak of the COVID-19 pandemic. Despite being an under-resourced country, Cambodia's containment of COVID-19 is widely regarded as notable success from a strict containment phase to high vaccination recovery phase. Humans, animals, and their environments do not face separate risks. They share the same destiny. This gathering provides a platform to reshape traditional approaches toward a One Health culture, a systemic, integrated, and unifying approach to safeguard human, animal, environmental ecosystems. Global progress is evidence, with advances in genomic sequencing, along with recognitions of climate change and biodiversity loss, and as drivers of One Health risk. Countries are strengthening governance, adapting environmental safeguards, integrating surveillance systems, and addressing zoonosis linked to deforestation and wildlife trade. Yet significant challenges persist. Pandemic risks from pathogen spillovers due to wildlife trade, disrupted ecosystems from climate change, all of which require coordinated global actions to build resilient One Health systems. Cambodia has consistently demonstrated its commitment at all levels. Domestically, Cambodia has addressed One Health risks through surveillance and community engagement across multi-stakeholders, monitored wild bird migration and ecosystems, and advanced biosecurity and risk-based approaches to animal health while improving infrastructure, surveillance, and markets and logistics. Internationally, we remain committed to the WHO's pandemic agreement and its AMR surveillance systems, and environmental initiatives like the Global Plastic Action Partnership, as well as other important initiatives under the ASEAN frameworks. Excellencies, the time has come to translate our commitments into bold actions. Allow me to share 5 insights. First, on partnership and solidarity, we should further advance regional and global collaborations, share knowledge, resources, and technology across governments, scientists, civil society, and communities. Second, on integrated surveillance and early warning system, we should continue to harmonize standards, expand genomic sequencing, and ensure rapid responses. Third, on sustainable financings and innovation, we should further mobilize long-term international mechanisms, increase domestic investment, and foster public-private partnership. Fourth, on combating antimicrobial resistance and climate pressures, we should further promote responsible antibiotic use, enhance monitoring regulatory reform, and integration of climate safeguards into health and agricultural policies. Fifth, on promoting knowledge, equity, and preparedness, we should ensure evidence-based policy, invest in laboratories and workforce development, guarantee equitable access to life-saving tools, and empower communities through awareness. Excellencies, ladies and gentlemen, now it is time to transform momentum into lasting impact. Together, we must scale up collaborations, strengthen preparedness, secure sustainable financings, and promote equity at the core of One Health. Together, we can translate today's progress into global resilience and benefits people, animals, and ecosystems everywhere. And thank you very much for this opportunity. Thank you.
Thank you, Prime Minister. Thank you. So thank you, Prime Minister, for sharing the priorities from your perspective. As you say, there is a lot we should and must do going forward. And we look forward to seeing what comes next for Cambodia's engagement in advancing One Health. Minister Planas, next I'd like to welcome His Excellency Luis Planas, Minister for Agriculture, Fisheries and Food of the Kingdom of Spain, to outline Spain's One Health priorities and commitments.
Merci, mesdames, messieurs, chers
Thank you,
collègues.
ladies and gentlemen, dear
Juste
colleagues.
quelques remarques.
Just a few remarks. I already spoke this morning on the analysis of the consequences of animal health on human health and environmental health, to establish our future orientations that we all take together. And in my very brief intervention, I would like to mention and comment the public engagements and pledges that Spain has taken in the context of this summit. There are 4 concrete points which we believe are really demonstrate the efforts of this event and this meeting, especially taking into account that it is only on the basis of international cooperation that we will be able to effectively move forward on a transverse basis to meet the objectives that we have discussed yesterday and today. First of all, it's a declaration in favor of a food regimen which is healthy, sustainable, and guarantees food sovereignty for all. This is a question which is essential and must not be forgotten. As Minister of Agriculture, Fisheries and Food, the question of food security is dear to my heart, and I believe as it is for all of the participants of this meeting. And also, there is the healthy side of our products that are eaten by our fellow citizens. That's why it is important to adopt an international declaration on highly processed food. We need to establish a definition which would allow us to take measures in the future. I much prefer scientific evidence that has been presented so far and which continues to be developed in the immediate future. Second, there is the question of data upon which to base our reasoning. I believe this is vital. This morning, we talked about the extent to which zoonoses and zoonotic processes and vectors, how difficult it was to obtain data and to harmonize the data across the various stakeholder groups. But it's an even broader problem. All of the elements to be taken into account for the environment, climate, agriculture, biodiversity, even social aspects, must be taken into account. And it is important that we may have a shared approach with a harmonization of data in these areas. The third declaration, I believe, is a key. This is the international pact to preserve the effectiveness of antibiotics. This has been mentioned in several interventions. I mentioned it this morning. This is a question which we cannot leave to one side. It is fundamental. We cannot misuse antibiotics for livestock, for animal feed. And then in the case of Spain, since 2014, we have managed to eliminate 70% of all antibiotics used in the past in animal feed. But I'm sure we still have progress to make. This year, we will be publishing for the very first time data on domestic animals. This is a key element, and the third declaration which we support. And this is which refers to a restriction of the intentional use of micro and nanoplastics in products used in our daily lives. It is absolutely clear that all nano and microplastics are terribly harmful, not only for the environment, but also for our own health. And we have to work to eliminate them. I will conclude. I think that the spirit of all of these declarations really shows that we are ready to converge around international action, which needs to be coordinated. The role of UNSA, the FAO, the World Health Organization, United Nations Program for the Environment. All of this is necessary. And then as a representative of Spain, I am betting on this future to respect our commitments. And once again, congratulations to the government of France for organizing this meeting. Thank you for your attention.
Thank you. Please now join me in welcoming His Excellency Alain Motsoaledi, Minister of Health for the Republic of South Africa.
Madam Moderator, Stavros, Honorable Ministers, Excellencies and colleagues, it is a profound honor to represent South Africa here in Lyon as we gather to strengthen our collective One Health defenses. Making our food system safe and sustainable is not merely a technical goal. It is critical for public health, our economic growth, and our collective social well-being. The One Health approach reminds us daily that human animal and environmental health are inextricably linked. Nowhere is this more evident than in our food system. Food safety is a challenge that cannot be managed by any single sector alone. It requires a coordinated, decisive action across an increasingly complex landscape. Today, that system stems from farm to fork and from sea to plate. And as we look to the future and new technology, it may even extend from laboratory to plate, where a single animal cell can be transformed into edible meat. To manage this complexity effectively, we must work together to prevent foodborne illnesses, including zoonotic agents, to identify all risks at the earliest possible stage, and respond with speed and precision to outbreaks and emergencies. When we do this, we do more than just manage a system. We will be protecting lives, building trust, and supporting long-term development. In South Africa, we are translating these principles into high-impact national initiatives. We have established a One Health Food Safety Technical Working Group to bridge the gap between the sectors. We are strengthening our food emergency alert and recall systems, improving our capacity for rapid risk assessment during outbreaks. Crucially, we are developing integrated data systems to ensure that our reporting is as fast as the risk we face. Our efforts are firmly aligned with global frameworks, including the Sustainable Development Goals, the International Health Regulations, and the One Health Joint Plan of Action. Guided by these pillars, South Africa is committed to strengthening our national health system through improved coordination, collaboration, and communication. In closing, a safe and resilient food system is the bedrock of a healthy nation. Through this coordinated One Health approach, South Africa remains steadfast in its commitment to protecting our people and their environment, strengthening our food systems, and contributing to global health and food security. I thank you.
Thank you, Minister. I'm going to now turn to the panelists who are here with me seated on stage. Can I start with you, Dr. Duneton, for Unitaid's activities in this area?
Yes, thank you, Emma. Maybe I need a microphone. This is working. No, thank you, Emma. And I will start to say that I will not try to be pinky, rosy, or something like this, describing at least the situation and the diagnostic we have for potential future pandemic. I just want to thank Peter and the Global Fund during the difficult time of COVID-19, and especially because we were in charge of the therapeutic pillar, and it was not the easiest one, I have to say. And it turned, by the way, that the situation, in particular in Africa, was the lack of access to oxygen. And I think that most of the people who die actually in Africa die from a lack of access of oxygen. And so that's why we create the coalition with WHO, with a lot of partners. And I want to call also Dr. Barbosa, director of PAO, who is now the actual co-chair. A lot has been made, a lot needs to be made, even in a difficult situation we face in finance. We have been lucky during the COVID-19 because we had a vaccine that works, even in a way it was not totally expected, let's be honest. And we don't know if it will be the case in the future. So despite the best effort of the industry, of CEPI, we are facing like a dozen of pathogens identified by WHO. And in France, we don't have the tools. And I think that the lesson we learn through the pandemic is when we are not ready, it's a problem. And we are running after a virus that we don't control. And this is a situation we may face again in the next 20 years, according to the best expert and analysis of WHO. So there is a track, there is some progress in terms of vaccine, but we are not there. But we need to realize that even if we have a vaccine, have a therapeutic and a diagnostic is key in the response. For many reasons, because of science, but also we need to be honest, because of politics. The acceptation of the vaccination, even when you have evidence, is not a given. So we need to have different tools. What is not rosy is the outcome of trying to repurpose drug. Frankly, according to WHO, more than 90% of the clinical trials to look after the efficacy of repurposed drug fail because of the design, because of the power, because it was a wrong drug, because of a lot of things. By the way, the only one that went very well was in UK to demonstrate the efficacy of dexamethasone. But beyond that, a lot of effort, a lot of money, and no results. Another thing we learn is also the fact that if you don't think about access at the beginning, also it doesn't work. You need to have a tool, but you need to have a tool that is accessible, available, and usable in the north and in the south. So there are characteristics. So just to say that there are some progress. There are some progress with WHO. We've launched this morning with WHO Cork, with CEPI and NRS. I think that the science is absolutely important, but we are thinking, we have been working along this 18 months with IPPS. Victor Zhou, co-chair, is in the room. And we decided that first we don't want to create a new organization, because it would be insane, but instead to prefer to have a coalition that will help and enable the work in terms of strategic direction, scientific support, developing the platform. And we have been working with the NDI, we have been working with MPP, we have been working with Intrepid from industry. We need industry to develop its tools. And we have a project now that can be up and running. It's absolutely key, but I have to say that we need money. So we have looked at a lot of commitments. We are looking at the strategy of ERA at the European Commission, which is really, really good. Some member states, but there is a fatigue. You know, nobody wants to talk about the pandemic situation. This is, I think, a problem. But again, I think that we don't have a real choice, and we really need to make things moving and happening. So thanks for the support. Thanks for, and I will come back to you with Victor, because really we need to move the needle as soon as possible. Thank you.
Thank you, Dr. Duneton. Indeed, I totally agree. The therapeutics arm is a little weak. So you all heard that. It needs funding. That's how we get from concept to reality on the ground. So I'd like to move now to Mr. Mérieux to share with us what the Institut Mérieux's perspective is on this. We'll pass the microphone.
Bien, je parlerai français, si vous permettez. Ce que je peux dire, c'est l'expérience d'une longue vie
is the experience of a very long life of an industrial dedicated to biology. 30 years devoted to vaccines for humans and animals, and it was already a One Health approach. Then there was the diagnostics, and then food security, which we've always worked on. We've always had a planetary approach, or a worldwide approach.
One Health.
And we've always been One Health.
Ce que je peux dire, c'est que
and what I can say is that diagnostics is very important, especially for vaccines. You have to identify the strain. And when there was an outbreak of meningitis in Brazil, we had to identify a bacteria that had actually come from Africa. It was the meningo A. And we were able to vaccinate because we had already prepared the vaccination for sub-Saharan Africa. The same thing for foot and mouth disease. We also had to identify the strain, and we mentioned this over lunch in Botswana in the 1980s. It was important to identify the strains, which were South African tech, and we had to produce the vaccines on site. So this is even more important, and as we've seen with the major epidemics we've been hit by, AIDS, COVID, as well as Ebola. With Ebola, 6 years ago, at the request of our friend Professor Ngomie in the Democratic Republic of Congo, I met with him to talk about what they'd done. They worked on Ebola. He also worked on COVID, then Ebola, and more recently, monkeypox. So this shows that in just a few years, just 5 years, this laboratory had to face numerous emerging viruses, which shows that the world is excessively mobile, with a multitude of new emerging viruses, as well as antimicrobial resistance. These are two phenomena are hitting us very hard, and there are no borders between countries, between animals and humans. So we're quite happy with our approach. It wasn't me, but they've now worked to bring together 25 signatories who committed to working together to develop and launch a pact for diagnostics, Diagnostic Compact Global Health, which was decided today. These 25 participants from industry, major organizations, and governments who will together work on a diagnostic approach without borders, and which will be within the One Health approach. And all of the experience I've had on the ground, in particular during the earthquake in Haiti, we saw that it was a single health. There was the earthquake, and then there were problems with the vaccinations, with diagnosis, problems with drinking water, pollution, nutrition, food, and these are problems which are growing and which we cannot dissociate from our approach to biology. I was in Madagascar recently, and they say, why should we vaccinate children if the children don't have enough to eat? They're undernourished. And then the pediatric wards of hospitals in the Tenerife. Malnutrition is the primary cause of death for children today. So the One Health approach has to take much more than classical biology into account. So what conclusions can we draw from this world in movement? Well, first of all, we have a Pastorian vision of the world. I have the privilege of having had a grandfather who worked in 1894 with Mr. Pasteur, and we've always remembered his vision and approach, which is planetary, without borders,
between the two types of medicine, no borders between medicine and food, no borders between countries, religions, economies. That was Dr. Pasteur's message, which is very strong. And now, more than a century later, it is just as meaningful and just as violent. So we have to keep that vision. It comes from far, but it is just as relevant today. So the experience I have drawn from my long life is that we need an approach which is close to that of bacteria. They're constantly adapting to their environment, and that they don't like, that they don't control. And that's what we have to do in full humility. We have to adapt to climate change, scientific upheavals, molecular biology, artificial intelligence. We have to adapt to demographic upheavals. When I was born, there were 2 billion people. Now there are 8 billion of us, mostly in the south. And today, more than ever, we have geopolitical tensions that we now have to adapt to. So let's be humble and act like bacteria and constantly adapt to face the numerous challenges we have. And I believe that a meeting such as this one, the One Health Summit, which is in Lyon, is extremely important. It brought together a lot of energy to fight against a challenge which is beyond all of us and which must bring us together more than ever. Thank you.
Thank you, Mr. Mérieux, and for reminding us that our understanding of the connectedness goes back quite a long way. I'd like to turn to Mr. Sands now to share with us what's going on with the Global Fund.
Thank you. I'd like to focus my remarks on malaria, in part because of the 3 diseases I'm charged with, HIV, TB, and malaria. It's the one that keeps me awake at night. And in part because it's an infectious disease that absolutely demands a One Health approach. Now, you may say that's a bit easy because it's a mosquito-borne disease and therefore, of course, it involves animals. But it goes beyond that. The number of mosquitoes that can transmit malaria is actually highly influenced by agricultural practices, by sanitation infrastructure, or the lack of it, by climate change, including extreme weather events. If a child does get bitten, their risk of death is hugely affected by whether or not they're malnourished. Their survival rates fall very rapidly with malnutrition. Communities have known for generations that keeping a village clear of unnecessary vegetation or getting rid of stagnant water, of planting plants that deter mosquitoes are part of good malaria control. And arguably the most cost-effective large-scale intervention, one that drove much of the progress we've seen against malaria, has been the insecticide-impregnated bed net, which is absolutely a One Health intervention. But it also illustrates the challenges, because over the almost 2 decades that we've been using these nets, the mosquitoes have gradually become resistant to the most commonly used insecticide. And so together, actually, with Philippe and his team at Unitaid and with some private sector manufacturers, we worked on developing and piloting a new generation of dual active ingredient nets. Dual simply means they've got 2 insecticides, so if a mosquito's resistant to one, it's highly likely that the other one will kill it. These were rolled out at scale in sort of 23, 24, and they cost 70 cents more than a conventional insecticide-impregnated bed net, and are about 45% more effective. So it's no surprise that actually the vast majority now of the roughly 200 million bed nets a year that we fund countries to procure are these new dual AI nets. The need for a One Health perspective is also illustrated when you consider one of the most kind of interesting and potentially exciting innovations to fight malaria, which is gene drive, genetically modified mosquitoes. If you were taking a narrow human health perspective, the idea that you could sharply reduce the number of mosquitoes, or you could make it more difficult for them to transmit the malaria parasite, seems like a bit of a no-brainer. But if you take a broader One Health perspective, a whole set of quite concerning questions come to your mind about, well, what's the broader environmental impact, like on the food chain and so on, and how do we manage those risks? This is not to say we shouldn't pursue such innovations. We definitely need new tools to fight a disease that is killing a child every minute. But we should do so taking that broader view of what the potential risks and considerations might be. Malaria surveillance is another area where this is intricately entwined with One Health considerations. We're helping countries link their meteorological systems with their malaria surveillance systems so as to better understand and hopefully predict what extreme weather events might do to malaria incidence. We're helping them track specific malaria species. There's a particularly nasty piece of work called Anopheles stevensii, which is a mosquito that likes urban areas and also likes to bite during the day. Understanding the spread of that is critical to understanding the epidemiology of malaria. And we're helping track parasitical resistance. We're seeing increased incidence of resistance to first-line treatments. And again, we've seen this happen. In the early 60s, malaria became resistant to chloroquine, and we saw a massive surge of deaths. We want to make sure we're ahead of that, because it will happen. We are seeing increasing artemisinin resistance. The challenge, of course, with all this kind of surveillance is the geography of malaria. Malaria is at its worst in the poorest and often most conflict-ridden places. Doing this kind of complex surveillance is difficult enough in a stable, relatively wealthy place. It's extremely difficult in a conflict zone. I mentioned all these things because they're all sort of intrinsically One Health in nature. Of course, there are innovations in the malaria space which are more narrowly human health, whether it's better vaccines, better diagnostics, new first-line treatments, new prophylactics. But ultimately, if we're going to beat malaria, we have to crush transmission, and transmission means beating the mosquitoes, and that inevitably means taking a One Health approach. The Global Fund provides almost 2/3 of all international funding for malaria programs. By the end of last year, our cumulative investment in fighting malaria amounted to about $21 billion US. Today, I'm announcing that we will invest more than $3.5 billion in malaria programs across more than 60 countries over the next 3 years. And this funding will help avert over 300 million cases of malaria and will save more than 4 million lives. Now, we can only do that because of the long-standing and extremely generous support of donors. And I would like to acknowledge Joseph Sikela's announcement earlier this afternoon of the European Commission's €700 million contribution to the next grant cycle of the Global Fund. The European Commission has been a steadfast supporter of the Global Fund. And I'd also like to acknowledge that France, too, continues to be a very strong supporter of the Global Fund. Indeed, it was here in Lyon that President Macron hosted our very successful 6th replenishment in 2019. But we have to do better against malaria. We had 2 decades of great progress. Progress then stalled, and when the numbers come through for 2025, I'm afraid we will see that more more kids will have died in malaria in 2025 than in 2024. This is a preventable, curable disease. Every child that dies of malaria is an avoidable death, is an avoidable family tragedy. It affects the very poorest in the very poorest countries. And with sustained funding, with the kinds of innovations I was talking about, with the kinds of One Health approaches I mentioned, we can beat malaria. Countries have done it. It requires political will, it requires resources, it requires ingenuity, but it can be done, and we should do it. Thank you.
Thank you so much for that quite concrete commitment there. To say the least, something else that is funded. Excellent. Lastly on our panel, before we go to Dr. Soubeyran for kind of closing, is Dr. Nicolaou. Please tell us what Aspen is up to in this space.
Thank you very much, Emma. Let me greet all the colleagues and excellencies. It's a wonderful pleasure to be here today with you in Lyon. Before I make my commitments, Emma, some prefacing remarks. Firstly, what does One Health mean to us? It means having health security in every single corner of the world, just very simply put. Regrettably, we are enormously far away from achieving that. And Africa is probably the furthest from achieving that. That's my continent, where I come from. And it's important to reflect on one statistic, which is that Africa is home to 15% of the world's population, yet it harbors 25% of the global health disease burden. So you can see the disproportionality in all of that. And I needn't remind anyone in the room that during COVID, regrettably, Africa found itself at the back end of the queue. Africa resolved that that should never be repeated ever again. And a commitment was made in 2022, in fact, May 2022, at a head of state bureau meeting, which coincidentally President Macron attended, I remember very well. The commitment was made that Africa should procure 60% of its pharmaceuticals, vaccines, and other medical countermeasures from Africa by 2040. And in fact, President Macron has been a great advocate, an avid advocate of health equity, health sovereignty, and vaccine equity in Africa. So it's opportune that we're meeting here today in Lyon. Now, Emma, let me get to the commitment, because that's what we're here for, right? To kickstart Africa's ambition of 60% of its vaccine, pharmaceutical, and other medical countermeasures procurement by 2040, what I referenced earlier, Aspen, which incidentally is the biggest investor, South African investor in France, and we're also the largest pharmaceutical investor on the African continent. We will commit to 3 things here today. Number one is we will pre-qualify 2 important pediatric vaccines used in routine vaccinations. I'll name the vaccines. They're a hexavalent vaccine and a pneumococcal vaccine. So we will pre-qualify those before the end of this calendar year. It's a pity Dr. Tedros left the room earlier, because we're going to be quite reliant on him, but he has made that commitment himself. The second commitment is that we will go into manufacture of these vaccines by late Q4 this year and early Q1 of 2027, which means African patients will start to benefit from these vaccines. And I needn't remind anyone in the room that outside of clean running water, the next best preventative measure is vaccines. Now let me get to my third and final commitment, which is many speakers here today have spoken about the rising tide of non-communicable diseases. And I think many people think that this is an affliction that is very specific to mainly developed and mature economies. Well, it's not. We face a massive rising tide of non-communicable diseases, particularly things like diabetes. Type 2 diabetes is becoming endemic on the African continent. It's linked to obesity. It belongs to a complex of diseases called cardiometabolic renal complex of disease, and it is sinister in the extreme. So we will commit today that we have worked as Aspen Pharmacare with Novo Nordisk, the Danish company. We will contract manufacture human insulin, which will be used for consumption mainly in Africa from May 2026. So that's in about a month's time. Novo Nordisk will do the distribution, we will do the manufacture, but what it does achieve is it strengthens regional manufacturing on the African continent, and security of supply can only be achieved through regional manufacturing and strengthening thereof. As I said earlier, it's been a great privilege being here today, and I do want to thank, and I hope the Minister for Francophonie and International Cooperation, she's sitting in front here, will convey this message personally to President Macron, that he was the European leader that came out during COVID and supported Africa. And we have never forgotten that as Africans. Thank you very much. Merci beaucoup.
Thank you, Dr. Nicolaou, and thank you to all of the panelists for outlining your commitments. We've seen commitments on key aspects of One Health outbreak control, including cooperative initiatives on the key tools of diagnostics, vaccines, and therapeutics. There's a lot here, and some of it's even funded, which is great. I'd just like to close my part by saying again that what I hope for is to see this turned from commitment to reality, and that this whole agenda really does get translated in a way that we face the next pandemic threat more effectively than we did last time. So with that, I'd like to hand over to Dr. Soubeyran to conclude for us on this panel. Thank you.
So, Excellencies, distinguished speakers, ladies and gentlemen, we live in a world where converging crises, food insecurity, climate change, biodiversity loss, and geopolitical instability. But beyond these global trends, today's exchanges have reminded us of a persistent and yet often preventable risk, zoonotic diseases. Rift Valley fever, West Nile, tuberculosis, and so many others continue to affect us and to claim millions of human lives every year. Today, it has been said already, but around 60% of human infectious disease and nearly 75% of emerging infectious disease originate in animals. And these biological threats, whether natural, accidental, or intentional, deliberate, are increasing in complexity. And as previous speakers emphasized, security does not begin during crisis. Security begins with prevention. Yet, despite clear evidence, we continue to underinvest in this first line of defense, in particular in animal health systems. And let me, as DG of the World Organization for Animal Health, give concrete figures. Animal diseases reduce livestock production globally by 20%. costing farmers an estimated cost of $300 billion every year. And yet, veterinary services, animal health systems, receive on average less than 0.05% of national GDP. At the same time, the resources required to strengthen these systems, veterinary systems, globally are estimated as just 2.3 billion US annually, a drop compared to the cost of a single global health crisis. And even more striking, every dollar invested in animal health can generate return up to 86%, according to the World Bank. Thus, a paradigm shift is needed. Prevention should not be seen as a burdening cost, but as one of the most strategic and the smartest investment for global health security. Excellencies, today's discussion has made very clear that infectious health threats often emerge at the human-animal health interface. But by reinforcing our first line of defense, we are able to detect threats early, prevent their spread, and prevent local outbreaks from becoming global crises. In doing so, we protect economies, saving human lives and ecosystems. And this is why we must move, and that's what we are doing today, from reaction to prevention and from silos to integrated systems. The One Health approach provides us with the framework to do exactly that. And I would like to share with you today some concrete initiatives on prevention, surveillance, and preparedness we are committed to advance, and it's a commitment in a One Health approach. First, on prevention at source. Let's start with a very powerful example, which is rabies. Rabies is a demonstration that investing in animal health directly saves human lives. It shows that prevention works and that it delivers concrete, measurable public health outcomes. It is, you know it, a fatal disease, but entirely preventable through dog vaccination, timely post-exposure prophylaxis, and community awareness. But today, rabies still exists in more than 150 countries and continue to claim more than 60,000 deaths every year, mostly children and mostly in low and middle-income countries, a number which is largely underestimated. We know how to eliminate rabies. We have the tools. We have the tools, and we have demonstrated we can do it. So let's make a commitment today and use this example not only as a disease control program, but as a model for One Health in action, an indicator of success. And let's save children by vaccinating dogs while building wall of government One Health systems for future threats. This is one of our concrete proposals. Second, on surveillance. Prevention depends on our ability to detect and monitor pathogens across human, animal, and environment. This includes also wildlife, essential to anticipate emerging threats. At WOA, we ensure global transparency through our notification system on listed disease, which provide critical real-time information to all. But we must go further. And we will launch WildEpi, a real-time wildlife health information system. And in line with the One Health Data Conversion Declaration of Intent, all our data will be shared with partners for integrated surveillance systems. Third, preparedness. Remember, during COVID-19 pandemic, veterinary services played a critical role, notably by supporting human testing through veterinary laboratories. Though in many countries, we faced multiple barriers before that collaboration could become effective. Building on this experience, we decided we want to advance on a structured framework called Beyond Silo to support the integration of veterinary services into national preparedness and response mechanisms to natural, accidental, or even intentional biothreats. I have a hope when I was listening to all this investment. Let's share resources. Let's raise awareness of donors, investors, and private sector. When you invest, when you innovate, think One Health, think human, but also think animal. In sharing equipment, we spoke about genetic sequencing, in access to vaccine, to diagnostics, and in scaling of innovation. In closing, I would like to reaffirm the support of WOA as part of the quadripartite to members for adapting our collective response to evolving threats. And the increasing spread of avian influenza, which can be maybe the potential tomorrow pandemic, across species and regions, including spillover into mammals, illustrate how quickly biological risk can evolve. And in response, we are advancing a quadripartite strategic framework on avian influenza to strengthen coordination, enhance surveillance and risk assessment, and reinforce response capacities across sectors and borders. We are also launching a new joint working group with PRESOD to strengthen the translation of science into policy and action, particularly on prevention. And because effective One Health systems rely primarily on people, we have advanced with FAO and WHO on a joint One Health learning task force to improve workforce capacities, because effective systems depend on skilled professionals able to work across disciplines, make informed decisions, and build trust. And we rely on our respective collaborating center in One Health, Hillary for us, and in training. And I would like to say just a word and thank VetaGroSup here in Lyon, which is one of our collaborating centers. Excellencies, one message to go back with. Health security begins with prevention, and prevention begins with One Health. We have the knowledge, we have the tools, we have the partnerships. What we need now is to scale up investment, integration, and political commitment in a true One Health spirit. This is a necessity, and this summit and your commitments give hope to the animal health sectors. Thank you very much.
Merci, Madame la Directrice Générale. À vous
Thank
et
you,
à
Director General, to you and to the International Centenary Agency based in Paris of reminding us of the essential links between human and animal health.